السلام عليكم ورحمة الله وبركاته. الدكتور رغدان زكي سعد، تدريسي في كلية الصيدلة جامعة بابل، فرع الأدوية والسموم. محاضرة اليوم موجهة إلى طلبة المرحلة الرابعة. So, today's lecture is about pharmacology of adrenocorticosteroids and adrenocortical antagonists. And as a history, in 1935, cortisone is isolated from the adrenal cortex, and in 1937, deoxycortisone is synthesized by tedious registine. And then, in 1938, cortisol is isolated from the adrenal cortex by Edward Kendall. After that, in 1949, Hans Style describes stress syndrome and the role of adrenal gland. And in the same year, in 1949, Philip Hench, Edward Kendall, and tedious registine synthesized the adrenocorticosteroids and described their physiologic and pharmacologic actions. And they got Nobel Prize in 1950. And in general, the hormones of the adrenal cortex, they are secreted by the adrenal cortex, and the natural adrenocortical hormones are steroid molecules produced and released by the adrenal cortex. And those are glucocorticoids. They act on intermediary metabolism and immune function, like cortisol and corticosteroid. Then we have mineralocorticoids. They have salt-retaining effects, like aldosterone. And then we have androgenic or estrogenic corticoids. In general, they have many physiological effects, and the prototype of glucocorticoids is cortisol, which is the naturally occurring glucocorticoid. And this glucocorticoid exerts a wide range of physiologic effects, and those effects include stimulation of protein catabolism, thereby increasing plasma amino acids, also stimulation of gluconeogenesis, and this happens when amino acids are converted to glucose, and then sometimes glucose is converted to lipids. Also, they act in stimulation of glycogenesis. Also, they facilitate the general sympathetic stress response. Also, they can cause stimulation of the central nervous system, and by this, they might cause irritability and insomnia. In addition, they have immunosuppressant effect by decreasing white BC counts, especially lymphocytes, and causing lymphocytopenia. Also, they stabilize lysosomes in cells, thereby decreasing cell injury and decreasing inflammation. In addition, they inhibit the synthesis and release of histamine, kinines, and prostaglandins, thereby decreasing inflammation and immune response. Also, they inhibit collagen synthesis, thus they decrease fibrosis and scar tissue formation, fibroblast synthesis, and this will cause protein breakdown. The rate of secretion follows a circadian rhythm governed by pulses of ACTH that peak in the early morning hours and after meals, especially after lunch. So the peak concentration of glucocorticoids, we expect that the peak will be on the early hours of the morning. In the plasma, cortisol is bound to circulating protein. Corticosteroid binding globulin bind about 90% of the circulating hormone under normal conditions. The remainder is free, which is about 5 to 10%, or loosely bound to albumin, which is about 5%, and is available to exert its effect on the target cells. Here we can see the fluctuations in plasma ACTH and glucocorticoids throughout the day. So we expect, as I said before, glucocorticoids concentration will be higher at the morning, and then we can expect the concentration to be decreased during sleep, then the concentration will increase at the early hours of the morning. Then we have regulation of glucocorticoid secretion. Glucocorticoid secretion can be regulated by corticotropin-releasing hormone, which acts on the ACTH, and then ACTH causes stimulation of glucocorticoid secretion. Also, glucocorticoids are released in response to stress, like in physical trauma, infection, hemorrhage, and cold. I talked before about natural corticosteroids. Now, I'd like to talk a little bit about the available synthetic corticosteroids. So, there are short to mediate acting glucocorticoids, intermediate glucocorticoids, long-acting corticoids, and mineralocorticoids. The prototype of short to medium-acting glucocorticoids is hydrocortisone, which has 1-to-1 ratio anti-inflammatory and salt-retaining effect. Also in this class we can see cortisone, prednisolone, methylprednisolone, and in intermediate acting glucocorticoids we can see triamcinolone, paramethazone, and fluprednisolone. Whereas betamethasone and dexamethasone represent the long-acting glucocorticoids, and finally fludrocortisone and desoxycorticosterone acetates represent the mineralocorticoids. Then I'd like to talk about indications of corticosteroids. First, they have adrenocortical, they can be used in adrenocortical insufficiency, like in Addison's disease. Also, they can be used as immunosuppressant drugs in case of organ and tissue transplantation, autoimmune disease, rheumatoid arthritis, rheumatic heart disease, rheumatic fever, ulcerative colitis, and Crohn's disease, multiple sclerosis, lupus erythematosus. Dermatomyositis, scleroderma, juvenile onset, like in type 1 diabetes mellitus. Also, corticosteroids can be used for the treatment of allergic reactions, including allergic dermatitis and urticaria, conjunctivitis, tetanus asthmaticus, insect bites, drug reaction, and serum sickness. In addition, they can be used in the treatment of inflammatory disorders like bursitis, osteoarthritis, myositis, pericarditis, thrombophlebitis, exudative dermatitis, and psoriasis. Also, they can be used for the treatment of cerebral edema. As I said before, they have immunosuppressant effect, especially they act on decreasing lymphocyte counts, so they can be used for the treatment of lymphatic leukemia. Also, in cardiovascular diseases, they cause stabilization of myocardial cells following MI, and also they can be used in non-infectious oral lesions, or one of the indications of corticosteroids is stimulation of lung maturation in the fetus. Then from the indications or physiological effects of corticosteroids, we can expect the adverse effect of corticosteroids. First, even at large doses, they have minimal side effect. If they are given or once or twice, they can cause Cushing syndrome on chronic use. They can cause protein catabolism, muscle atrophy, and weakness. Osteoporosis can be occur. Also, they cause slow healing of wounds and GI bleeding and ulceration. They reduce the resistance to infection. They can cause hyperglycemia, redistribution of fat in the body, thereby causing moon face, buffalo hump, purplish striae on abdomen. Also, they can cause hyperaldosteronism and sodium retention or water retention. Also, they can cause potassium secretion, thereby causing hypokalemia. Also, they have CNS effect. They can cause behavioral and personal changes, insomnia, mania to depression, tinnitus, and they can increase appetite. In addition, corticosteroids, they have androgenic effects, thus they can cause hirsutism and amenorrhea. Also, they can cause adrenocortical suppression, thereby causing weakness, lethargy, anorexia, nausea, muscle tenderness. Thank you.